If cancer radiation were a multiple choice test, cervical cancer would often be all of the above. It's one of the rare situations where both external and internal radiation are used. One thing that is surprising about cervical cancer is that very early stage cervical cancer is treated with surgery, like a hysterectomy, but beyond that, radiation and chemotherapy are used instead. And this seems counterintuitive because in some ways, you'd think that more advanced cancer would mean more surgery. But after a surgery like a hysterectomy, the tissue is studied under a microscope for specific warning signs, and we know now that the risk of recurrence is unacceptably high if those are found without postoperative radiation and in some cases postoperative chemoradiation. And the more types of treatment you combine, surgery, chemoradiation, the higher the risk of side effects. So when we know that a patient already has some of these warning signs on physical exam and preoperative imaging, aka they are a more advanced stage of cervical cancer, the recommendation will be to skip surgery and instead get chemotherapy and radiation to replace surgery. External beam radiation therapy is given by aiming beams of radiation through the body to treat not only the visible tumor, but also the areas at highest risk for hiding microscopic cancer cells. And internal radiation is given at the end of several weeks of chemoradiation to treat the main tumor in the cervix so that the total dose adds up to something that can replace surgery. Of course, my favorite answer to the cancer radiation multiple choice test is none of the above. So I'm excited that cervical cancer rates are declining in the US. This is thanks to our superhero colleagues in primary care and OBGYN working to diagnose patients when they have cervical precancers rather than invasive cervical cancers and vaccinating patients against the virus that causes this terrible disease.